everybody, and welcome to this week's Heart of CX podcast. My name is Max Ball, and my partner Joanna Palmer is here with me today. And Joanna, you brought a friend again.
Hey Max, how are you?
I'm good.
Good, good. Yes. I have another guest on the show today. Super excited about today's topic, trends in customer experience in healthcare. So when we think customers in healthcare, it's, patients, providers, members. And so really have an expert in this area. John, go ahead and introduce yourself.
Thanks, Joanna. Thanks, Max. Appreciate it. Name is John Poli. I am the healthcare industry principal at Ring Central. I joined Ring Central June 2020. Been here about a year. I come to Ring Central after about 7 years with Gartner as an executive professional,
Hmm.
working directly with the CIOs in Gartner's portfolio and helping them work through digital transformation. A large bulk of my clientele at the time were payer and providers and hospital systems. So digital transformation in healthcare was a big part of my life. At Gartner, prior to that, I was a president of a small analytics company in healthcare doing tools for the payer community. And prior to that, out of Seattle, Washington, I was the CIO at Delta Dental. So about 15 years in senior leadership, both on the buy side and the advice side in healthcare and healthcare technology. So coming to Ring Central was a natural extension, I thought, of my career because there is no better platform, I think, than UCAS and CCAS to drive digital transformation in healthcare.
Yeah, definitely. And joining Ring Central last year in June, you know, uh, during the start of the pandemic, I'm sure that healthcare has changed tremendously, or it definitely has changed tremendously over the course of the last 15, 16 months. What are some of those long-term trends that you're seeing emerge in healthcare?
Well, the things I think we're seeing most rapidly happening, one obviously is the advent and the permanence of telehealth, the movement from being able to have a provider or care provider to patient experience remotely, having it over high definition video or having it over other mediums was just the start of kind of the transformation of care and care coordination. More broadly, we saw that the operational management of care and both payer and provider changed rapidly with the advent of advanced contact center distribution of workforce, the ability to do direct routing and start to connect teams in new ways with collaboration tools, all started to really take herd in 2020 because it had to, because there was no other way to get information passed around, to meet with patients, to collaborate amongst professionals. So all that stuff, while it happened rapidly, it was out there for a while, but it really got adopted very quickly. And now the industry is kind of sifting through what's optimized, how do we best think through it, looking at the costs. And so we're very excited to be part of that as we talk to our clients about that transformation.
Excellent, excellent. So as we think about the contact center in healthcare overall, one of the common trends that I hear from various different healthcare organizations is just the additional contacts that they saw throughout their organization during the height of COVID. Do you think those additional contacts are going to continue, and how do healthcare organizations really handle that?
Well, I think the acute need for communication between patients and doctors was very acute during the COVID crisis because of the fact that there were so many unknowns and so much information was coming out real time that the need to get clarity from their primary care or from specialists, from the hospitals, from distribution, vaccines, all of that new information was needed. And it really, again, it enabled that use, those new use cases enabled the need to contact your provider not once every 6 months, but on an ongoing basis to make sure you're up to speed with the most recent information, the most recent updates on care and managing the disease and the protocols. And so I think that we're seeing kind of a permanence starting to occur. It ties very nicely, however, to the trends that we had been seeing all along before COVID, which is this movement from care management or acute activity management to more of a wellness approach to healthcare, where you're looking at a patient's life cycle, you're understanding their chronic diseases potentially, you're looking at their long-term wellness as a complement to the actual activities within healthcare facilities, so that you can get a real full picture of the patient. And contact center is a key part of that communications interface because that's where you're going to do the outreach, the inquiry, as well as the coordination follow-up where needed across the healthcare continuum and that life cycle of the patient.
And I really like that in terms of thinking about healthcare and thinking about some of the trends we're seeing overall within the contact center. Proactive outreach is definitely a trend we're seeing overall. Conversations and relationship building rather than thinking about customer service as just a transactional organization is
Mhm.
another major trend we're seeing. And it sounds like we're also seeing those trends in healthcare as well.
Certainly, this construct. Most provider systems are looking to provide what they call the digital front door, which is opening up really the environment where patients and providers are having an ongoing conversation, whether it's through messaging, through media, through social media sites, for example, where they're just general information is being passed and there's a connection on an ongoing basis. Most healthcare providers of the future don't need, as I said, will need monthly, if not more frequently than monthly communication interface with their patients to be an impact, just like their cell phone apps today have an impact on them because they use them almost daily. Your healthcare provider wants to be part of that mind share. And the digital front door contact center allows you to create that environment for your provider environment. And that platform can then scale and provide all the other values that it does within managing the execution of a patient stay and a patient release.
So, what sort of information am I going to be going to my provider for on a monthly basis? I can think of a couple things, but I'm just curious, what is the stuff of that conversation?
Well, what we see happening, particularly as I said earlier with chronic care, is you're going to have a number of diagnostic systems out there that may be
Hmm.
remote. If you think of Internet of Things, where you're going to have health information about heart rate, blood pressure, glucose in cases of diabetic patients, for example, EKGs in cardiac care patients, a number of tools now will be there where doctors will be asking. We've seen situations where doctors are asking to check in on an ongoing basis, how you're feeling, what's your pain level. Those types of information feeds can be done through surveys and messaging on a daily basis. And then when you see spikes that are outside the norm, those become the patients you focus on and you target with proactive activity to bring them in maybe for more detailed analysis by the providers. But the overall health of the community of patients becomes something you can manage more broadly with that type of tool set. So I think it's a lot of it's going to be self-diagnosis by patients, which we have seen through studies can be accurate in terms of implications of health and managing their own health, as well as obviously the communication for outreach and execution post activity within a care facility. So, physical therapy, for example, or follow up
Hmm.
with a primary care physician. Those are the other types of messages you're going to see back and forth between your care provider and the patient. We're not going to just discharge you and say, good luck, check us in 6 months. We're going to follow you through a number of tools and we're going to make sure that we're checking in with you on an ongoing basis. And if the doctor has concerns that maybe they're not seeing activity, they can reach out and say what's going on with the patient and find out if in fact they're following protocol.
So I really like this idea of Internet of Things and being able to proactively monitor the patient's vitals. And so as we think about acute care and then post care follow up, are we seeing hospital stays shorten based on these technologies and being able to provide a higher level of care at home?
Well, if you look at the technologists and the futurists in healthcare, you've got things called virtual emergency rooms where you walk in, you get diagnosed, and they hand you a set of equipment, and you go home and you deal with the care from your home bedside. And so that is where a lot of people see the future. And we've seen a number of people experiment with what they call virtual hospitals, where if you have the tools that can monitor your condition, there's no need for you to be physically in the hospital if you can connect and have that done remotely. And so the power of that becomes very interesting over time, as well as the impact of it in terms of the patient's well-being and how they're cared for and how they feel during the stay.
Very cool. And as we think about the digital front door, along with this virtual ER, it just underlines and highlights the fact that you have to have this fully integrated contact center with this back end collaboration with experts, being able to pull experts in and out to ensure that you're effective. Um, but it also opens up a lot of virtualization, I'm sure, for providers as well as contact center agents. What are you seeing there with with virtualization?
Well, it was an enormous impact. Again, the need for remote access to doctors and the successful delivery of that care through telehealth, for example, last year enables now the virtualization of your professional staff and specialists in a way that's very interesting. Acceleration, for example, of the time it takes to get a specialist to a patient, but in fact they're not in the same, if they're not limited by geographic locations. The ability for providers to work across a number of different offices and support a number of different areas with virtual rounds, for example. We have clients who are doing that where the nurse will have a device where she can call or he can call and pull in a doctor specialist if they're available real time with the telehealth session. So those types of new tools are really enabling a connection to the right specialist with the right need faster. And that's been a big key. On the virtual team members, what we're seeing from the contact center personnel themselves, an incredible opportunity now to virtualize that workforce, not only in just enabling the use, obviously with the disease, to keep people remote and simply manage it with the tool set as granular as if they were in the same building, but now and also in opening up geographically of where those people can reside over time, right? You can almost permanently virtualize a workforce and create new ways. And we've seen clients look at new ways of hiring, new targeted areas to hire in. Really changes the way you think about your workforce going forward as well.
Yeah, and I would imagine we're going to see contact centers, and you really need the air quotes at this point,
Right.
that are nurses or even doctors or deep experts. And yeah, you'd have to have it because you're not going to have a cluster of those level of experts necessarily in a single area. And I, we talk about generally in the contact center, um, with automation, agents need to be more empathetic and smarter in the next level. I think in healthcare, that's going to be on steroids because there is so much expertise to be tapped. Is that something you're seeing or are people talking
Yeah, I
about
think
that?
well, in the first phase, you'll see things like direct routing, where you'll find the specialist in need from a contact center front end personally. Over time, I think you're right, Max. You'll also get specialists who will man and try and answer calls real time. We're seeing a lot more payers and providers investing in remote nursing staffs that are kind of at the front lines to help,
Mm.
diagnose, triage quickly, and take care of patients with one call. If that can be done, there's no reason it shouldn't be done, and it really enhances patient experience on that front. So that's very interesting opportunities there.
Awesome. I'm going to shift the conversation a little bit as we talk
Mhm.
about all of this future state technology. And when I say future state, of course, I'm using that pretty loosely because that a lot of this technology is already here. So one of the things top of mind I would imagine would be security and privacy and compliance in healthcare. And so how is that addressed in these platforms?
Well, what we're saying, one of the things, obviously, the key for these platforms to be effective is really a diligence around HIPAA compliance, right? To ensure that if you are ever speaking to private medical information about personal medical information, PMI data about a patient, that it is protected. It's encrypted both at rest and in transit, and it is protected and secured in the proper facilities throughout the management of that data. And so, Ring Central in our current view, obviously we are high trust certified, which totally encompasses not only a HIPAA structured environment, it also provides the process and procedure for validation. And we're very proud of being a leader in that. It's really helped us kind of innovate in the healthcare space to a great degree. And so really that provides you, if you think about it, wherever to all these different virtualization and distribution discussions we had about putting talent and people anywhere, anytime, every one of those interactions is protected. It's within the high trust umbrella, and by design can be effective. And that's why when we talk about this with such confidence, it's all about the fact that it's high trust certified.
Excellent. Excellent. And so with that as well, I know high cap is top of mind for a lot of healthcare facilities too, and ensuring that they have high survey results. And so as we think about these future state healthcare patient experience scenarios that we talked about, what are you seeing there with trends in high cap in surveys?
Well, the big thing, very simply, is that as the patient experience improves, and we have seen direct proof where the impact and the communication, the amount of time a patient is touching base with their provider over a period of time, that the increase in those number of touches improves their patient experience. They have more information, they're clear about what to do, they understand what doctors they're working with, what the next steps are. So by improving that patient experience, you drive those surveys and higher scores. And those higher scores obviously drive the reimbursement rates for Medicare and other issues that really drive revenue and margin. The other thing we see though as well is that, and we see it kind of an aggregate basis, we're seeing that high patient experience scores almost triple the margins in hospitals where you have low patient experience scores. So this is becoming material to the bottom line on healthcare is run. The other thing we're seeing over time is as we get more and more information from all these contact and communication activity on a healthcare or care environment, we're also seeing new opportunities to drive some revenues as well within, say, the Medicare space, because care of patients and the coordination of care are becoming billable entities within Medicare and the CPT code. So all of that drives margin and revenue in healthcare. So I think we're going to see some really interesting innovations occurring over time and workflow management in a new way over time in providers. And it'll also impact, obviously, payers on the backside when we start looking at these new integrated tools and the granularity of the capture of activity within that space they provide.
And so what it sounds like to me is healthcare systems can't afford to stand still. That really they have to, if they're not innovating already, they have to start innovating. If they're innovating, they've got to continue to innovate to ensure that they're continually driving up that revenue. And so, go ahead.
No, I think you're right on, but I would caveat that by saying it's not. We know for a fact, and we all know the statistics on healthcare spending in the United States, right? The reality is healthcare is a market that has to be re-engineered. The cost structure cannot continue to grow at the rate it's growing, be sustainable, whether it's our Medicare payments or our private insurance payments. And so the basic simple system needs to change. And I believe, and one of the reasons I think I'm so passionate here about it at Ring Central is that these integrated communication environments, contact center, UCAS tools, are a catalyst to this type of transformation. Re-looking at how workflow occurs, how you manage your care, how doctors, nurses, and patients interact, how members interact with their payer groups. All those things are opportunities to change drastically with these new tools because you free them from the physical infrastructure and you start to create new worlds with the software-based tools and the cloud-based environment.
Yeah. On that note, I think that that sums up our conversation, and really is that impetus for change. It is really transformational, and these tools can help transform healthcare. Max, any last thoughts?
No, well, yeah, I do. What's exciting to me, we sit around and talk about contact centers and customer engagement, and that's all great. But here, what we're talking about is literally life and death in a lot of cases. And the fact
Mhm.
that better communications and more engagement means stuff gets caught earlier and people don't end up having some horrible disease because it was able to be caught, or I'm able to get to the right expert and that guy can give me the right advice and something can happen. It's exciting to move from, oh, I'm making customers happier to, oh, I'm saving lives. And that to me is just really exciting and really something to get passionate about.
Yeah, I'm just super excited. I mean, we see the professionals that are on the front lines that are really servicing patients, the nurses, the doctors, the care professionals, to see how excited they get about these tools because they're the
Mm.
ones really bearing the brunt of kind of that honorable duty. And being able to service them and give them the tools to really succeed is very rewarding to your point, Max. I totally agree.
Excellent. Well, thank you so much, John, for coming on our podcast today and sharing your thoughts on healthcare experience.
Thanks, guys.
All right.
Thanks a lot. Talk to
Thanks.
you soon, everybody.
All right. Thanks. Bye bye.